Welcome. My name is Peter Strong. I'm a professional psychotherapist specializing in mindfulness therapy for the treatment of anxiety disorders, including agoraphobia. So if you're looking for online psychotherapy to help overcome your agoraphobia, then do please go to my website and learn more about the mindfulness therapy that I offer online through Skype. If you're looking for an online therapist, it's very important that you find someone who offers therapy via Skype or similar video platform so that you can see each other. You must be able to see each other in order to have an effective psychotherapy session, because you need good communication and you need to see each other in order to establish good communication. If you are struggling with agoraphobia and you are looking for an online therapist, then do please go to my website and learn more about the mindfulness-based approach that I use for treating agoraphobia. This system that I've developed over the last 20 years now is proving to be very effective. It's called mindfulness-based exposure therapy. And it's a way of basically desensitizing those habitual anxiety reactions that keep you a prisoner. You will learn how to set up a schedule of incremental exposure challenges, and then how to apply mindfulness training in order to neutralize those anxiety reactions associated with each of those challenges. The primary way that we do this is by learning how to meditate on the anxiety. So we play the scene through in our mind for that particular challenge. We watch for the anxiety reactions that may get triggered, and then we work on totally changing the way that we relate to that anxiety. The fundamental problem that people struggling with anxiety and depression have to deal with is the problem of reactive identification. This is a term that I coined some years ago to describe this way that we become blindly attached to that emotional reaction, to that habitual emotional reaction. The emotion itself is not the problem, it's this reactive identification that is the problem, because that basically activates the emotion, the anxiety, and gives it the power to cause emotional suffering. If you can overcome this reactive identification, then the anxiety basically will have no power to cause suffering. It just becomes an object that we can observe in the mind and that we can help heal. If you react to that anxiety, of course, you will simply feed it. And if you identify with it, that is what really ignites all that reactivity, the reactive thinking that feeds anxiety. So we train with the anxiety by meditating on it, by learning how to stay conscious, being totally present with that emotion without becoming overwhelmed by it, without becoming identified with it, and without becoming reactive towards it. This is a central theme in all mindfulness work. Mindfulness basically means being able to be totally present, consciously, with your experience, without reactivity. Whatever the experience is, pleasant experiences included. In order to be mindful, you need to be able to be totally present without reacting, because if you react, you basically inhibit full connection with that experience, and this will prevent healing in the case of anxiety and other forms of emotional suffering. You need to be totally conscious in order for suffering to heal. So we learn to be present with our anxiety by meditating on it. We play through the particular challenge that we are working with in order to identify the anxiety, and then we learn to sit with that anxiety without reacting. This is very important indeed. We can then move on to develop the second part of mindfulness work, which is developing a compassion and friendliness towards that anxiety. We see the anxiety as being in pain, as an object that's in pain. It's rather like a child coming to you in pain. It needs your help. It needs your conscious presence. It needs your friendliness and love and compassion in order to heal. And this is what we learn to do through mindfulness training and mindfulness therapy. We learn how to develop this kind of relationship with our anxiety, because that is the only thing that will effectively heal it. So if you'd like to learn more about mindfulness-based exposure therapy for overcoming agoraphobia, you'd like to learn how to apply mindfulness for overcoming anxiety, then do please go to my website and feel free to contact me. Tell me more about yourself, what you have tried so far, and tell me if you'd like to schedule some Skype therapy sessions with me. Most people see really quite surprising results in a relatively short time, and there's one reason for that, and that is because you are learning how to directly engage with your anxiety. Talking about your feelings is not directly engaging with them, and that's why that tends to be a slow process. It may provide temporary relief, but just talking about your feelings is not sufficient to heal the underlying emotional habits. The same goes for medications. Medications may provide a temporary relief from symptoms, but they do absolutely nothing to heal those underlying psychological reactive habits that cause your anxiety. So, if you'd like to learn more about the mindfulness approach to healing agoraphobia, and you'd like to work with an online psychotherapist like myself, do please reach out to me by email, and let's schedule a Skype therapy session so you can begin to experience directly how effective mindfulness therapy is for overcoming agoraphobia. Thank you.